For many people, makeup just isn't doing the trick anymore when it comes to looking younger.
40 is a new 30, 50 is a new 40, and that's kind of what's happening.
And keeping up with the latest celebrity looks is hard enough these days.
It puts a lot of pressure on people at times.
In our culture today, there is so much emphasis on those stars that come out.
If you're someone who wants lips like Angelina Jolie or cheekbones like Kim Kardashian, what if we told you you can actually see how you could look with them without getting any work done yet?
Patients have come into a practice and they don't know what to expect as far as how their surgery will go.
From nose jobs to even facial reconstruction surgery, the options are endless.
There's people that come in and they're ready for plastic surgery. They're wanting drastic results.
Using a 3D imaging machine allows the patient to visualize exactly what that'll be.
It's known as the Virtual Plastic Surgery Simulator, and here in Colorado Springs, there's only one office you can go to see yourself before and after.
It can be a catch-22 because you want to show them what you can do, but the expectations are also limited by the human body.
Dr. Smith says going under the knife isn't what it used to be when it first became popular back in its heyday.
As plastic surgery has evolved, there's a lot of new techniques that it's hard to describe what exactly that will look like.
Although this type of technology is out there are other alternatives also readily available to prevent aging right away.
Being the laser tech, I could say there's definitely lasers that can help generate more collagen and elastin, give people more of that effect of not so much a facelift, but definitely give them tightening, smoothing of the skin.
So does this simulated surgery software put pressure on surgeons to meet the patient's needs?
We have to be a little bit cautious in saying this might not be your exact result.
Or does it raise patients' expectations on what they should look like now that they see the results right in front of their eyes?
People come in with expectations of wanting to have like a very drastic change.
I tell them it will be very similar, but a little difference here and there.
Ultimately, this surgeon's goal with the simulator is to help folks feel good about themselves.
That's where the biggest change that I can have, the biggest impact that I can have in somebody's life is just to help them feel better and more confident about themselves.
And even though it's not for everybody, plastic surgery may be the way to go to get that end result.
As long as we're doing what's safe for the patient and taking care of patients like any other physician should be and putting the patient's needs first, I think then we'll gain more trust and hopefully will become more of a trusted practice.